we now have drugs that may specifically target this solvent front mutation. And the two that I mentioned in my talk, one is lorlatinib. This is a drug that already has an approval for ALK. And we've learned in one of the cohorts from the lorlatinib data that was published for ALK, one of the cohorts was ROS. And we've seen response rates around 30 to 40% in crizotinib-refractory patients. And this drug does have activity in the G2032R solvent front mutation patient populations. A small number of patients have been reported. The second drug that is gaining a lot of traction, not yet approved, is a drug called Repotrectinib, another drug that's specifically designed to overcome the G2032R solvent front mutation. And we have data from ASCO last year showing that this drug elicits meaningful responses in crizotinib refractory patients and also has meaningful responses in the brain, responses of around 40% in the crizotinib refractory setting. So, you know, in summary, number one, it's important that we deploy contemporary diagnostic platforms that can interrogate optimally ROS1, and that is an RNA and a DNA sequencing platform, next generation sequencing platform. Two is we now have two drugs approved for ROS1 rearranged lung cancer, crizotinib and entrectinib, both showing competitive outcomes, both showing response rates of north of 70% and PFS around 19 months, with entrectinib having an intracranial response. And finally, tackling resistance. We have two drugs that aren't yet approved for ROS,